Hello, everyone. Welcome to the Medical College of Wisconsin's Coffee Conversations with Scientists, where each month we bring you the science behind the health topics you're hearing about in the news. We are brought to you by the Advancing a Healthier Wisconsin Endowment, a statewide nonprofit that is working to improve health and advance health equity in Wisconsin. I'm Mark DeMoya, your host today. I'm the Chief of Trauma and Acute Care Surgery at the Medical College of Wisconsin and Froedtert Hospital. I'm thrilled to be here to talk about the science behind violence prevention. There's nothing that really grabs news headlines on a daily basis like any instance of violence, not just in our community and state, but nationally. We're going to talk a little bit about that. In my daily work as a trauma surgeon, I see the end result of violence, the people brought to the operating room with injuries from shootings, stabbings, and other types of violence. That is why I'm pleased to be talking with Reggie Moore, the newly named Director of Violence Prevention, Policy and Engagement at the Medical College of Wisconsin's Comprehensive Injury Center today. Reggie has recently joined our family at MCW after leading the City of Milwaukee's Office of Violence Prevention for 5 years. There, he advanced the city's efforts to address violence as a public health issue and helped launch the city's first comprehensive violence prevention plan known as the Blueprint for Peace. Reggie, welcome to the Coffee Conversations.
Thank you, Dr. DeMoya. It's great to be here.
As Reggie and I cover a great list of questions on the science behind violence prevention, I encourage all of you please to watching to please drop any questions you have on the topic into the comments. And I promise we'll get to them. We will be getting to as many of them as possible, so let's get started. What I'd like to do is first show you a graphic of the numbers of gunshot wound victims that have presented to Froedtert Hospital, the Medical College of Wisconsin, as a level 1 trauma center over the last couple of years. You'll see a couple of trends here. Trauma in general is a cyclical, seasonal type of variation that we see with the peaks during the summer times. So you'll see the first peak is in 2018, second peak was in the summer, second peak summer 2019, and then you see, boom, a big jump in the number in the summer of 2020. And then again, it came back down this past winter a bit, and then now is back up again. So this kind of variation is not uncommon, but we see this huge jump from 2019 to 2020, which was kind of reminiscent of what happened in, with our COVID numbers, actually. So Reggie, I'd like you to talk a little bit about, what does it mean to look at violence as a public health issue? What does that really mean?
Thank you for having me, and it's great to be here with you and the viewers who are tuned in. I think that's an important question. The term a public health issue has been applied to a range of issues in our community and in our society. And as it relates to violence, specifically, that has actually been a journey, even in the public health sector, where gun violence has not historically been seen as a public health issue. But it really is about understanding that if we look at all of the symptoms and the things that a typical epidemic or pandemic would produce, you would apply those same approaches to violence, understanding that there are risk factors in a community or in a society that increases the likelihood of someone being a victim or perpetrator of violence, understanding that there are strategies and interventions and protective factors that can actually reduce the risk or exposure to violence. And then also the focus on healing, understanding that the impact that gun violence has had and continues to have in our community and cities around the country, there's a lot of healing that needs to occur in terms of people being directly or indirectly impacted by violence, whether they are a direct gunshot survivor or know someone, whether it's a coworker, a family member, a friend who's been impacted by gun violence. And so that's something that we don't talk about a lot. I'm glad to be on here with you because you, again, on the front line, see the impact when patients arrive in the trauma unit. And so just understanding both as we try to support and help folks heal physically, we also have to do that emotionally, but we also have to heal an entire city.
Great. Speaking of the city, Reggie, in your role as in the Office of Violence Prevention there, and now in your new current role, what would you say were some of the kind of the major parts of the program that you had initiated and led in the city to try and combat violence. Talk a little bit about that.
Yeah, understanding violence as a public health issue took a paradigm shift, and it really required us to do a lot of outreach and education in the community about what that really meant. And we didn't have to go too far because, you know, we right now in society and in our country, folks are talking about reimagining public safety. The community has wanted to reimagine public safety for a long time because, again, the communities that are impacted the most or carry the heaviest burden of violence can tell you directly what's working and not working. And clearly what has been done to address gun violence hasn't been working. And so engaging the community and developing the blueprint for peace was the first and major strategy that we undertook. Because again, if we were going to shift not only the understanding, but the priorities and the investment in violence prevention, it's important that those priorities be driven by the community. And so it really became a movement of that was community led, that continues to be embraced by various sectors, the business sector, hospitals, healthcare, philanthropy, youth serving organizations. And so that's really what it took to really elevate, again, the idea of there are many things that we can do in terms of taking a comprehensive approach to public safety and violence prevention. And it really is about looking beyond just the absence of violence, but the presence of opportunity and access to resources and investing upstream to increase protective factors to reduce the likelihood of violence occurring.
You know, when you compare violence to something that people are very intimately familiar with, like COVID, what are the parallels that you might draw between the two when we talk about kind of it being a healthcare policy? Because, you know, it's a lot easier, I think, for people to understand, you know, an infectious disease problem like COVID being a public health issue and public, crisis, and as the pandemic is. So tell me what's similar to that in terms of how we might approach that framework to violence.
Right. There's a lot of similarities. And when you look at a public health approach, defining the problem took a while with the pandemic, and understanding what COVID was, what early on, you know, the impact that it was having, who was most vulnerable in terms of getting the sickest or perishing as a result of contracting the disease. All of these things were, I would say, in the early months of COVID, where a lot of the focus was. And then the second level of prevention, when you look at where is it, you know, who's most at risk of contracting it and where is it concentrated? And so looking at the factors, whether they be previous health conditions, understanding that over time with the pandemic, we learned that there were certain health factors that contributed to a person not surviving or being more at risk of perishing from COVID-19. And then from there, identifying interventions. Interventions, number one, to try to mitigate the spread and to reduce the likelihood of folks transmitting it from one person to another. And then once we got to a vaccine, on the prevention side, ensuring that as many people get vaccinated as possible. Understanding all of the underlying issues related to that in terms of certain populations, particularly the Black community being skeptical based on the history of this country and the healthcare system about the vaccine, but understanding that we have to confront those things head on, and we have to be honest and really understand where communities are coming from and be responsive to that. The same thing, we see a lot of parallels with gun violence. When you look at the Second Amendment and people having a misconception about violence prevention being anti-gun ownership. And so a lot of our focus isn't about the gun. It really is about understanding that there's a significant burden of gun violence happening in our country and on the streets of our cities every day. I know a lot of the mass shootings get attention, or the workplace shootings get attention. And again, I'm not saying that they don't deserve attention, but I think what we overlook oftentimes are the daily gunshot victims that or the gun violence that occurs on the streets of cities every day. And so with that being said, understanding again that violence is a learned behavior, it can become normalized, particularly when we work with victims and survivors of domestic violence. When we look at the perpetrators even, they talk about the fact that they grew up in environments or homes where violence was normalized. And so understanding that it's a learned behavior, it can be transmitted. If you grow up constantly surrounded by violence being a way that people handle or manage conflict, but also understanding it can be unlearned. And so it really is about what our intervention and prevention strategies to, again, build awareness and competencies around de-escalation, around self-management, but then also looking at the societal factors, right? So when you look at concentrated unemployment, when you look at concentrated poverty, all of these things overlay with the same neighborhoods that have high rates of gun violence. So those things can't be divorced from each other. And that really is what it means to take a public health approach, to understand that as we have to deal with things that what we call the thick, right, that are happening right now, we also have to look upstream and address some of the societal factors that are creating the conditions that perpetuate violence.
I mean, it's such a complex issue. Just like COVID is complex, but I think even more complex, than COVID for sure. And the fact that it's a multi-dimensional problem, really calls for multi-dimensional solutions. And in public health and in medicine, we really want to, we look at the evidence, we look at what works, what doesn't work. Can you give some examples of things that have been proven to work that you're trying to build upon here in the city or across the state, that to combat violence and the circumstances by which it grows, just like the virus?
Yeah, I'll give a couple of examples across the primary, secondary, and tertiary levels of prevention. So on the primary level, we know that after school programs, young people being connected to a consistent, positive, caring adult, whether that be a mentor, a coach, a Running Rebels staff person, those things are extremely important. And unfortunately, those programs go significantly underfunded in our community. And I call out Running Rebels because they just received support from NBA Cares for the renovation of one of their centers. And it's a program, and the programs that they run, they work with young people through athletics, but then also the Be the Change program, particularly with young boys, and really around building character, leadership, et cetera. Those are the types of programs that on the primary prevention side, we need to invest in. On the secondary prevention side, I would use the example of 41 for Life. And really, again, it kind of straddles both prevention and intervention in terms of secondary, because one, identifying individuals at highest risk of shooting or being shot, providing intense case management, support, life coaching to them, connecting them to individuals who we consider to be credible messengers and experts of the community. And they themselves, in some cases, may have perpetrated violence in their past, and understand and have the relationships to be able to detect when there's conflict that is happening, just through their street connections, be able to intervene in those situations before they result in violence. But then also through our hospital response partnership with Frederick Hospital and the medical college, being able to respond and support gunshot survivors and their families and begin to try to stop or prevent retaliation, even at the hospital level. And so that's a critical example. And we see cities around the country who are implementing violence interruption programs or hospital-based violence intervention programs at a greater scale than we have, I think, in the past 20 years. And then on the tertiary side, I would say the city's trauma response initiative is a critical example of providing support to children who've been exposed to violence, and really ensuring that they receive the mental health support that they need to be able to process and heal from that exposure. Because again, as I mentioned earlier, the sooner we can break that cycle, the better. And so that's a partnership between the Office of Violence Prevention and Milwaukee County.
One of the things that people are asking on the chat is whether or not there's anything that they can do to help. How would you direct folks, to be able to contribute to helping these efforts?
And I would be remiss if I didn't mention another in terms of a promise and effective practice, and that's policy. And that'll lead me to answer that question. As it relates to looking at emergency risk protection orders, as it relates to universal background checks, all of those things are also shown and important to reducing illegal access to firearms. And so I think number one, it's important that the public become educated about gun violence and the impact that it's having. The trace.org is an excellent source. Their entire reporting and focus is on gun violence, not only in the United States, but around the world. They talk a lot about policy. They've covered a lot of our work in Milwaukee. So I would definitely encourage folks to check out the Trace. Also, everytown.org is also a good organization to, again, understand not only the impact of gun violence, but also many of the strategies and solutions that are being advanced nationally and locally. I would encourage people to plug into the Office of Violence Prevention in the city of Milwaukee, to connect to Mentor Milwaukee if you have an interest in working with and supporting young people in our community. There are many community organizations that are in need of volunteers and support, and also financial resources. So if you're interested in investing in programs, whether it be Forum for Life, whether it be youth serving organizations in the community, all of that is welcome and needed.
That's great. Well, it's nice to, be able to, contribute to helping to stop some of this violence. But, the violence has been overall since the 90s, as you well know, violence has been decreasing across the country, slowly. However, over the last 2 years, there's been a huge spike in it, clearly related to COVID. What are your thoughts about, and not just gun violence? We're also talking about domestic violence. We're talking about child abuse, elder abuse. We're talking about suicide, and in addition to gunshot wounds and stabbings that we've seen. Why do you think this is happening? And what components of COVID has exacerbated perhaps an underlying condition of sorts?
Right, and I'll speak to that from being on the front line in the Office of Violence Prevention during and throughout the pandemic. I know that, from a research perspective, we have a long way to go in looking at causation as it relates to the pandemic and gun violence. But one of the things that we saw firsthand, and I think, most reasonable people could conclude, is that the pandemic caused a significant amount of stress and economic uncertainty and pressure on families and individuals who are already under a significant amount of stress and uncertainty. And so imagine in terms of losing your primary source of income, of not having access to childcare or be able to send your children to school. Even when we look at the data around child abuse reporting going down, the Department of Children and Family Services and other community organizations understand that it may have just gone underreported because children aren't outside of the home as much as they were pre-pandemic. And so all of those things still have to be examined and understood, but we truly believe that the pandemic caused a significant amount of stress and pressure that, again, we're still working our way through as a society as it relates to the pandemic. And the reason why, particularly in Milwaukee, that's important is prior to 2020, we saw and achieved a 4-year decline in homicides in the city. And for 2 years in a row, for 2018 and 2019, we actually ended the year less than 100 homicides. And we hadn't done that since 2014. And so for folks need to understand the context in which 2020 occurred and why our spike was so significant. We had one of the highest increases in the country. And so again, we want to get back to that momentum, but unfortunately, and I think cities around the country would say the same, that unfortunately 2020 set a new bar. And it's a bar that, again, for us is extremely, is unacceptable. And again, we want to definitely get the numbers back down to pre-pandemic levels, but it's going to take us doing things differently. We can't do the same thing and expect different results. We have to do different by policy. We have to do different by significant investment, and we have to do different by bold leadership that's committed and vocal about violence prevention.
One of the other questions that came up and you alluded to this a little bit earlier, regarding kind of the mental health component, the behavioral health component of people needing to be bolstered and improved in the city and even across the state. What do you think the role is of the mental health professional and the licensed social workers, and how they might factor into being part of the solution for stopping some of the violence?
Extremely, extremely instrumental. We know through the trauma psych program led by Dr. Terry DeGrun Cassini at Fredert, and the patients that they see along with Andrew in that division is extremely profound. And the support, helping someone heal from a traumatic event psychologically is just as important as their healing physically. And understanding that often when the mental health aspects of trauma go unaddressed, it can impact even their ability to seek the appropriate care and follow-up care for their physical rehabilitation that's needed as well. And so again, I think that's critically important. I know one of the things that many organizations across the community have increasingly become committed to is destigmatizing mental health and seeking help. We know that suicide attempts also went up during the pandemic, and what we would consider deaths by despair, whether they be overdoses, suicides, et cetera. And so people, again, are finding various ways to cope with the stress and the pain of this pandemic and just life in general. And what we want to do is to ensure that people understand that help is available, that there's nothing weak about seeking help. It actually takes a lot of strength to admit that you can't do this alone. I've been there personally. And so again, I think, mental health, not just talking about it, but really ensuring that we have the resources invested in it, and also that people have ready access to it. And I also want to stress to this question as well, and it made me think about it when you mentioned some of the professions, and when people were asking what they can do to help. I can't underscore enough how important it is for us to approach this as a movement, whether we're talking about violence prevention in general, mental health, gun violence. And when we say a movement, that means everybody has a role to play, and everybody may not have a title in the work, or it may not be your profession, but if there's an argument in your proximity and you help de-escalate it, that's violence prevention and intervention. If there's somebody that that you care about that's struggling with mental health or addiction, and connecting them to help so that they don't end up incarcerated or ended up hurting themselves or others, that's violence prevention. Making a phone call, advocating for universal background checks is violence prevention. So again, I want to stress the importance of, although some of us work in this professionally, that we all have a very important role to play.
That actually, I think such an important point, and it gets to the kind of, stay in your lane kind of concept, that really this is all of our lane. We're all responsible for this space, and we're all part of this community. And so, as a trauma surgeon, I find that it's, it really is a responsibility that we own to help to prevent violence, just as we did and do with, say, motor vehicle crashes, with seatbelt laws, identifying patterns of injury is kind of what we do, identifying patterns that are causing violence and then trying to intervene. In fact, injury prevention in general, if you say injury across the board, prevention is actually a mandated component of a level 1 trauma center like Fredert. And so it really is our lane, even in trauma surgery, to help to try and do what we can to decrease the violence in our community. And you're making it even broader. It's almost, it falls on all of our shoulders, because this is a really an epidemic in and of itself, not necessarily like COVID, but very much similar to COVID in how it's viewed. Are there one of the other questions that was brought up, or are there any programs or resources available to assist our healthcare or mental health professionals and public workers with burnout?
When you say burning, as surviving burning or
burnout?
Burnout, that's what I thought. Okay.
Yeah, yeah, yeah.
I think sector by sector, I know a lot of organizations have EAP programs. This is something that definitely is a priority and topic of conversation within the Office of Violence Prevention. It's also a priority for the CIC here at MCW. When we look at workplace violence, for example, understanding that many of these issues or incidents, there were signs or warning signs that occurred, and ensuring that workplaces are thinking about safety, not just in reaction to an incident or something egregious happens, but what are you doing to make sure that workplaces are safe and inclusive on a daily basis, and understanding the type of work that social workers, what I would call, I call hard work, in terms of folks who are in the business of helping people. Vicarious trauma is real. When we look at even first responders, firefighters, law enforcement, trauma surgeons, all of the things that you all are seeing on a daily and regular basis, even my time in the Office of Violence Prevention, understanding what our Forum for Life team is also exposed to, it is very important that the healers also receive healing and have access to resources to take care of themselves in order to continue to do this work. And I think that when that doesn't happen, that can be extremely harmful to organizations and the community. And so again, I think, Milwaukee has talked about being a trauma-informed city, and they have actually implemented training for all city staff around understanding trauma. I think that's one step. But in terms of the burnout question, I think Sir Joyner Family Peace Center does a good job. They actually have acupuncture, massage therapists who come in and provide, free services to the staff at least once a week, and they've opened that up to other organizations that are in this type of work. So again, understanding the importance of taking care of the people who are helping people.
That's so important. We see, burnout, and even in trauma surgery, there's a recent report actually, Reggie, that 60% of trauma surgeons were feeling burnout this past year, actually, just given the degree of violence that we're seeing. In terms of the violence, I know we brought this up earlier, but there's a lot of different kinds of violence, right? And it's not just about gunshot wounds. It's not just about stabbings. How does domestic violence factor into all this? And maybe you could expand on that a little bit, and suicide as well, because those are two, I think, big buckets of the types of patients that we see and the types of injuries from violence that we see.
Yeah. Definitely we saw an uptick during the pandemic, and, literally supporting the Forum for Life team this weekend and de-escalating a situation that was connected to domestic violence. And it's pervasive, and it spans, race, class, gender. And in this particular situation involved, 20-year-olds. And so we know that teen dating violence is also an issue. So some of these, again, the exposure to violence starts young, those behaviors start early, and unfortunately they continue. And in some cases they escalate to people being physically harmed or killed. And so as it relates to gun violence, we've also seen a connection there as well, where there were several gunshot survivors last year and homicides directly connected to domestic violence. And so again, there's been a lot of focus and good work on providing shelter, support to survivors. I know that in the past year, there's been an increasing focus on services for perpetrators. And understanding, again, the cycle of violence that's being perpetrated is a cycle that has to be broken. And often that requires that person to confront maybe things they haven't confronted before in their own life, and to receive the services and support that they need. And it's important that those services are also culturally responsive. So you look at organizations like the ASHA Project that has a men's support group in particular to try to, again, address some of those issues, because a lot of the lies as men that we've been told about what does it mean to be a man in terms of power, control, et cetera, have been extremely harmful, not only to us, but also to people that we care about and to the world, quite frankly, when we look at wars. But I won't digress. But in terms of, as it relates to domestic violence, we have a lot of work to do. And again, we can't ignore the people that are causing harm, and we have to get to them before another act of violence is inflicted and they end up in prison, and that person ends up in a hospital, or the victim ends up in a hospital or a graveyard. And so we just have to do a better job across the spectrum. As it relates to suicide, within the CIC, Sarah Colback leads that work and is really looking at how do we ensure, one, that we're providing support to young people in partnership with organizations like the Office of Violence Prevention and Milwaukee County, but also making sure that the services are accessible, that they're culturally relevant, and again, that we are destigmatizing people receiving the help that they need. There were several high-profile suicides, I know in the Black community over the past year, that really was a wake-up call, in the sense that, again, it's something that we just don't talk about, and especially as men, we don't talk about enough, and we don't share our pain enough. And so, again, going back to the movement conversation, we all have a responsibility to the people in our lives that we know, love, and care about, and really making sure that we're being that ear, that we're being responsive. We're not just, brushing it off like you'll be okay, but really saying, hey, how can I actually do more to help this person, or how can I walk with this person, whether we're talking domestic violence or whether we're talking suicide and mental health.
Somebody brought this question up in the chat. We got, you're just talking about suicide. We have a suicide hotline. We have 911. What about a violence prevention hotline of sorts?
Yeah, we kind of have that with 411 for Life. We put them up on billboards. There's a number that folks can call if there's a conflict that they know about and they would like 411 for Life to get involved. There are other hotlines in the city, the Stop the Beef hotline. So this isn't a new idea in the sense of, trying to create access points for people to get support for particularly conflict-driven, violence, but we definitely have to do more. I also want to highlight VR Fast, which is a cross-sector collaboration where you have public health, community, law enforcement, the basically entire criminal justice system, but then also policymakers all at the table discussing shootings every week, and talking about what can we do moving forward to prevent violence, but then also understanding where violence is being concentrated in the city and the communities that are most impacted. So it's being smarter and surgical about addressing gun violence, while at the same time understanding that there's primary population-based prevention strategies that, again, every young person, every community, every family should have access to.
Yeah, it sounds like there are a lot of opportunities there potentially for making that connection, but I'm not sure that it always happens, right?
Right.
And just like we had vaccine hesitancy, in certain populations, I would imagine that there's some hesitancy in our Black and brown communities, either because of fatigue or because of fear of reaching out and connecting with some of these violence prevention, resources. What do you think about that?
Two ways I approach that is the Joyce Foundation 2 years ago did a study and a survey of young people in Chicago, and particularly young people who carried firearms, and asked them why do they carry firearms, and over 80% indicated that it was out of fear. It was the fear of being caught without one versus being caught with one. And when you live in an environment where you're afraid of being shot or injured, that has or if you are yourself directly a gunshot survivor, the PTSD of that and the fear that generates, that even the perception everybody must have a gun, that is a dangerous society, not a dangerous community. That's a dangerous society, because fear has been the predominant narrative that, well, everybody should own a gun, or everybody should be afraid of their neighbor. And we don't talk across communities. And this just isn't in the Black and brown community. This is a US phenomenon. And, we really have to get back to what does community really mean? How do we actually create safer communities? I believe we do that through following the strategies in the Blueprint for Peace, where the community has told us what we should be doing and investing in. As it relates to seeking help around conflicts, I think the idea when there's a lack of trust in law enforcement or the criminal justice system, street justice becomes the predominant strategy. And so again, when there's a breakdown in systems, when there's a breakdown in trust, you have people sort of taking their health and safety and well-being into their own hands. So the systems also have to own some of the things that, many of the things actually that we're seeing in our community, and show up and do better in terms of ensuring that folks know that Forward for Life exists. So that's why we did the billboard campaign. And we're constantly pushing out that message, because there hasn't, frankly, been a lot of help, and people have felt like they've had to rely on getting retribution or retaliating on their own in order to getting some semblance of justice. And just looking at the numbers, I mean, you look at 2020, where we had 190 homicides plus the 87 that we have year to date in 2021. That's 277 homicides, and that's 277 families, co-workers. Like, you think about the ripple effects of those 277 people. And then on the non-fatal shooting total, 1,196 people. That's 2020 to 2021 year to date combined. That is a lot of pain. That's a lot of violence. And it's going to require a lot of resources and expansion of solutions and strategies that we know work. And really, again, you look at what, the governor in New York declaring gun violence a state of emergency. That's something that, quite frankly, every state in this country should be doing right now.
Well, with that said, Reggie, I wanted to thank you for the time and your insights into this really important and dire situation that we're in right now. And I thank you for all the work that you've done, and continue to do for the community of Milwaukee and beyond. If you have any questions, if we didn't get to your question, feel free to drop us an email at conversations@mcw.edu, and we'll be happy to answer those to follow. I hope you all join us next month for a virtual coffee break and conversation on science, and we'll see you then.